In this video, you will learn what happens with your baby this week, what happens to your body, things to do or consider this week. Feel free to leave a comment if you have questions. Did you know that your baby moves 450 times a day? For some women this can be painful, and there are even women who get bruised ribs from this. Your baby is already very strong. At 43.3 centimeters and 1,863 grams, your baby is as big as a pineapple and as heavy as a doll carriage. He or she will also be able to distinguish between day and night by now. During this period it is important that you take it easy, otherwise there is an increased risk that there may be undesired consequences in the development of your baby. So make sure you don't stress too much and take your rest. Stress has a negative influence on the blood circulation, and that is not good for you and neither your baby. There is a good chance that you will suffer from nesting urges these weeks. Because you are focused on the arrival of the baby, you are probably forgetting all the other stuff. You are distracted and you forget important appointments. Fortunately, you now have an excuse for forgetfulness, and that is your little one in your belly. Of course, it can be very annoying if you forget something important again. Make it as easy on yourself as possible. Record all appointments directly in your planner, and do not assume that you will be able to remember them without writing them down. If your baby has not descended in the past few weeks, there is a good chance that this will happen when you are 33 weeks pregnant. This can be accompanied by lightening crotch and ligament pain. Unfortunately, this is one of the ailments that you can't do anything about. Take some more rest if it bothers you a lot. You can also suffer from stomachache and abdominal tightening in week 33. Your organs come under pressure, and this can cause abdominal pain. Constipation and diarrhea can also be accompanied by abdominal pain. Try to eat as healthy and fiber-rich as possible to prevent intestinal problems. Practice contractions can still occur these weeks. They will slowly turn into real contractions. These can be quite painful. It's a kind of cramping feeling that keeps intensifying and then becomes more subtle. The contractions during your delivery are similar, but they will be even more intense and in quicker succession. You can use the practice contractions to practice puffing. That can come in handy during childbirth. You will probably continuously feel fatigued these weeks, and that can be very burdensome. Especially if you are still working or have several children at home. The only thing you can do against that fatigue is to rest as much as possible. And ask for help in time. You will be amazed at the number of people that would want to lend a hand these final weeks. You are now 33 weeks pregnant, and that means that you could actually give birth any moment from now. Many give birth before the calculated date of 40 weeks. So it's important to have your hospital bag ready for when the time comes. Even if you want to give birth at home, it is important that you already have your hospital bag ready. It just doesn't always go as planned. You can only give birth at home after 37 weeks of pregnancy.